Greetings everyone, myself Dr. Manjeeta Dhume, Senior Resident from the Department of Oral and Maxillofacial Pathology, Dental College and Hospital, India, presenting before you a presentation titled Squamous Cell Carcinoma in the Elderly, a Growing Concern in the Aging Populations. These are the contents of my presentation. To begin with, geriatrics is the branch of medicine that deals with the diseases and the care of the old people. Various factors predispose this geriatric population for the development of various types of acute and the chronic condition. A prime concern is the reluctancy to quit various types of deleterious habits, either smoking or smokeless tobacco, especially as an etiological agent for the development of oral squamous cell carcinoma. At first glance, cancer and aging represent opposite processes, but at the molecular or the deeper level, they share the common origin, which is the accumulation of various types of cellular damages. This type of cellular changes have been systematically diversified as hallmarks of cancer and hallmarks of aging. These two represent five different types of the relationship between the two, which include the antagonistic hallmarks, the tumor promoting hallmarks, the ambivalent hallmarks, the metabolic commonalities between the two, and the common ones are the meta hallmarks. A glance at the microenvironment in the healthy and the aged individual. In a healthy individual, there is a renewal of the fibroblast taking at the periodic intervals, but as the person ages, the renewal of this fibroblast is decreased. Also, with that, the secretome and the phenotypic changes of the fibroblasts have been also deprived, which leads to a state of immunosenescence, ultimately leading to a chronic state of chronic inflammation. This stage predisposes an elderly individual for the progression of the tumor by producing the tumor promoting factors and thus leading to a frank carcinoma. After the histopathological confirmation following incisional biopsy, a comprehensive genetic analysis and also toxicity risk assessment is carried out. The prime important factor of ultimately after all this is increasing the quality of life of an elderly individual and not the quantity of the life. Asian Geriatric Oncology Society have diversified various screening tools commonly used in India. One of them was derived by Banerjee et al., which is the screening of older person with cancer scope, which has 8 domains and it can be easily carried out in any of the restricted Indian settings. The commonly followed treatment protocols for the oropharyngeal cell carcinoma include surgery, radiotherapy, chemotherapy, either together, solemnly, or adjuvant, or the newer type of therapies such as the targeted therapies or the immunotherapies. A large-scale study done by Tom Barrett et al. In 2021 from the National Cancer Database have shown that elderly patients frequently receive less treatment than similarly aged younger patients. And also, there is underrepresentation of this elderly individual in different types of the clinical trials, leading to a bias in the statistical analysis. A systematic review of literature in the PubMed database for past 5 years have shown that apart from the conventional therapies, newer treatment protocols or therapeutic interventions have shown successful results with a long-term follow-up and without recurrence, especially in relation to the geriatric population. We conducted an institutional pilot study wherein 55 cases were analyzed and grouped into three categories as young, middle-aged, and elderly. The elderly individuals were around 15 of them, which have been regularly followed up without any recurrence. Thus, to conclude, geriatric oncology is a vital specialty wherein team of doctors are necessary in order to provide personalized care to the patient based upon their individual characteristics and preferences. In India, due to the heterogeneous population and lack of data from the elderly individual, it necessitates the medical oncologist in order to extrapolate the results from the studies done on the younger individuals onto the elderly individuals. Hopefully, the near future will see standardized treatment protocols and the comprehensive genetic assessment depending upon the individual regions. These are my references. Thank you, everyone.